up a bit on Senator Murray's questioning about VA providing abortion services. At the time of Secretary McDonald, it was determined that the VA had the authority to provide abortion services in the case of rape and incest. That is authority that they were deemed to have. So the fact that you are not providing such services is an ideologically based decision, not one, in my view, required by the law. And yes, we all acknowledge that VA is the largest healthcare system. And when we started with this regime, and you came and testified, we acknowledge that. But it was in the midst of thousands of VA employees being fired with little to no notice, and thousands more taking their early, whatever the Doge fork in the road process was. And you had to, you obligated the VA to pay for all these people not working. And in the midst of what could be described as chaos at the VA, while all of this is still going on and questions about even more people, maybe 85,000 more people you were contemplating firing or letting go, you come to us with an entire reorganization of the VA. And it's hard to take it seriously, frankly. You testified just now that there is currently an investigation being undertaken regarding the murder of Alex Pretti. Who is this investigation being conducted by?
Senator, I'm of the VA. You'd have to consult DHS and others on that.
Because neither Homeland Security Secretary Noem or FBI Director has indicated that they are about to undertake an investigation into what happened to Mr. Pretti. The kind of independent investigation that I would say the majority of people in this country are calling for. So since you don't know anything about it, how about expressing your maybe personal opinion? Do you think such an independent investigation should occur with regard to one of your employees?
I agree with the President of the United States, who said it was going to be investigated and will continue to be.
You know what? His definition of investigation is not the kind of independent investigation that we are calling for. This regime is implementing a lot of the items that are in Project 2025. And when I look at Project 2025, what it says about the VA is, a quote, to rescind all departmental clinical policy directives that are contrary to the principles of conservative governance. Now, with this reorganization plan, which this is the first time I'm being presented with any of the information, would you say that, are you following Project 2025 and you want to have a top-down organization that will follow the principles of conservative governance, whatever that means? Are you following that language from Project 2025?
No, Senators, I said in my confirmation here, and I haven't even read it, and by the way, we're in 2026. I'm trying to run the VA for today. I'm not sure why we're looking backwards to something I'm not doing.
Well, because the President is following and implementing a lot of the items in Project 2025, one of the largest being to totally eliminate the U.S. Department of Education support for public schools. I find it hard to sort of, get that what you're doing is not following what is in Project 2025, which is a very ideologically driven directive on how the VA should be run. And it seems to me that when I look at your reorg plan, what I can make of it is a really top-down kind of organization. In fact, when I visited the VA in Hawaii, he had to go and get approval from, I think, you or somebody that is a totally top-down. And I wasn't given permission to visit my own VA person until practically the day that the visit was scheduled. Is that how it's going to be?
No, ma'am.
I think that is a rhetorical question.
Well, it's not rhetorical to me because we're actually here to explain this to you. And if you would take it to ask questions about RISE, you would figure this out.
Excuse me, Mr. Secretary. It all sounds good. You're trying to save money and all that, but at a time
No, ma'am. I'm trying to help veterans. Let's get the point right first.
That's good to know.
I appreciate it.
How is helping veterans? How are the veterans supposed to be helped if it's going to be a top-down organization
Senator,
where your hospital directors are not really going to have the right to hire people? You have a pause or whatever it is on them making those decisions.
There's no hiring freeze right now at all. In fact, it just shows to me, unfortunately, that all the information that's been given to your staff and others is not filtered up enough, because if you're saying this reorganization is a top-down approach, then I'm sorry, I'm not sure what kind of charts I can show you that this is not. This actually puts the benefits back at the executive director level in the hospitals. This actually puts our front line. We've had it so reversed.
Actually, Mr.
We've had it so
Secretary,
reversed, Mr. Chairman and others, that it is actually that.
You know what, the top-down and giving more flexibility to the local hospitals so that they can really formulate.
That's what this plan does.
Care plans.
That's what it does.
But that was what it was originally, that to have 25 or whatever the number is, that was what was intended, and now you're bringing it back to a very centralized 5.
No,
you see,
you're missing the point here. I think, Senator, this is a great
conversation.
conversation, but you're missing the point. When, as Greg Goins, who's a career VA employee, has stated, the VISN directors were not in a position to actually do the management level diagnosis that needs to be happening. So now we're having management level at 5 where they can do the management levels for the divisions, while we have health service areas who actually are able to talk to your hospitals in Hawaii and other places. If you look at this plan, I would welcome any disagreement except for one, and that is the fundamental wrong statement that this is a top-down plan.
Oh, that's what it looks like to me. And you can say all the things that you want, but it's all in how it's going to be implemented. And to come up with this whole reorganization plan at a time when there's basically chaos in this regime, it's pretty hard for me to. It's pretty hard for me to kind of say, oh, well, I think this is really a great thing that you're doing on behalf of the veterans.
Senator Kramer.
Mr. Chairman, can I answer that last? In the midst of chaos, it is amazing to me that we've cut the backlog. It's amazing to me that we've actually lowered wait times. It's amazing to me that through this process, we've made it easier for our veterans to get the health care service they need. If that's chaos, maybe we're in the right direction.